Top 25 NHS Band 3 interview questions and answers. Starting a career in the NHS as a Band 3 employee requires preparation, confidence, and a clear understanding of the role. Below are the top 25 NHS Band 3 interview questions with answers designed to help candidates present themselves effectively, showing competence, compassion, and teamwork skills that align with NHS values. Use these examples to guide your own responses during interviews. 1. Tell me about yourself. I have several years of experience in healthcare support roles, providing compassionate care to patients and supporting clinical teams. I am motivated, reliable, and highly organized. My focus is always on patient well-being and ensuring effective communication with colleagues. I have developed strong interpersonal and problem-solving skills that help me manage challenges in fast-paced environments. I am now seeking a Band 3 role to grow professionally and contribute further. 2. Why do you want to work for the NHS? I want to work for the NHS because it represents care, compassion, and equality. The NHS provides opportunities to positively impact people's lives, and I value contributing to that mission. I admire the commitment to patient-centered care and teamwork across different departments. Joining the NHS allows me to develop my skills, progress in my career, and serve my community while upholding values of integrity, respect, and excellence. 3. What do you understand about the Band 3 role? The Band 3 role involves providing high-quality support to patients and healthcare professionals. This includes assisting with clinical and non-clinical tasks, maintaining accurate records, and ensuring patient safety. Band 3 employees often act as a vital link between patients and the wider healthcare team. They must show empathy, attention to detail, and strong communication skills. The role also requires adaptability, reliability, and commitment to delivering excellent service within the NHS. 4. How do you handle stressful situations? I handle stressful situations by staying calm, focused, and prioritizing tasks effectively. I take a step back, assess what needs to be done first, and communicate clearly with colleagues. Deep breathing and keeping patient safety at the center help me maintain perspective. If I feel overwhelmed, I seek support from the team. Over time, I've developed resilience, which allows me to perform well even under pressure and tight deadlines. 5. Can you describe a time you worked as part of a team? In my previous role, I worked with nurses and healthcare assistants to deliver patient care efficiently. One patient needed urgent attention, and we quickly delegated tasks to ensure safety. I provided reassurance while my colleagues handled clinical duties. Through clear communication and trust, we resolved the situation smoothly. This experience taught me the importance of teamwork, flexibility, and mutual respect. It highlighted that excellent healthcare depends on effective collaboration. 6. How do you prioritize tasks during a busy shift? I prioritize tasks by assessing urgency and importance. Patient safety always comes first, followed by time-sensitive duties. I use checklists to stay organized and communicate with the team about priorities. If unexpected situations arise, I reevaluate and adapt quickly. Delegating tasks where appropriate ensures efficiency. I also make sure to balance speed with accuracy, as rushing can compromise safety. This method helps me deliver consistent, high-quality care during busy shifts. 7. How would you deal with a difficult patient? I would deal with a difficult patient by remaining calm, respectful, and empathetic. I would listen carefully to their concerns, acknowledge their feelings, and try to understand the root cause of their frustration. Using clear communication and patience often helps de-escalate tension. If necessary, I would seek support from colleagues or follow escalation procedures. My goal is always to maintain dignity, compassion, and a safe environment for all patients. 8. What motivates you in this role? I am motivated by knowing that I can make a positive difference in people's lives, even through small actions. Helping patients feel comfortable, respected, and supported gives me satisfaction. I also find motivation in working as part of a dedicated team, where collaboration leads to better outcomes. The NHS provides opportunities to grow, learn, and progress in my career, which keeps me inspired and committed to delivering high-quality service. 9. How do you maintain patient confidentiality? I maintain patient confidentiality by following NHS policies and guidelines strictly. I ensure sensitive information is only shared with authorized staff directly involved in patient care. I never discuss patient details in public spaces and handle records securely. If I am unsure, I seek clarification from senior staff. Respecting confidentiality builds patient trust and ensures compliance with legal and ethical standards, which are critical in maintaining professional integrity in healthcare. 10. How do you manage conflicting priorities? I manage conflicting priorities by staying organized, using time management strategies, and seeking guidance from senior colleagues when necessary. I prioritize urgent and safety-related tasks first, while scheduling others appropriately. I communicate openly with the team to ensure workload balance and avoid duplication. Remaining flexible and adaptable helps me handle unexpected demands effectively. I also stay calm under pressure, ensuring that patient care remains consistent, safe, and of high quality. 11. How do you show compassion to patients? I show compassion by treating every patient with kindness, respect, and dignity. I listen attentively, acknowledge their feelings, and offer reassurance when needed. Small gestures like a smile or comforting words can greatly improve their experience. I adapt my communication to their needs, ensuring they feel understood and valued. Compassion means being patient, empathetic, and supportive at all times, helping patients feel cared for in challenging situations within the NHS. 12. How would you support a colleague who is struggling? I would support a struggling colleague by offering to listen and providing encouragement. If appropriate, I'd help with tasks to ease their workload. I would also suggest they speak with a supervisor for additional support. Teamwork means looking after each other, and I believe a supportive environment helps everyone perform better. By showing understanding and offering assistance, I contribute to a positive workplace culture where colleagues feel respected and valued. 13. Describe a time you solved a problem at work. In a previous role, a piece of essential equipment malfunctioned during a patient's care. I quickly reported the issue, reassured the patient, and found an alternative solution to continue care safely. I then worked with maintenance to resolve the fault. By staying calm and proactive, I minimized disruption and maintained patient safety. This experience taught me the importance of problem solving, clear communication, and quick thinking in healthcare environments. 14. How do you ensure accuracy in your work? I ensure accuracy by double-checking records, following procedures carefully, and paying close attention to detail. I avoid rushing and take time to confirm information before completing tasks. I use checklists to stay organized and verify critical details with colleagues if necessary. Accuracy is vital for patient safety, so I remain focused even during busy shifts. I believe that being thorough prevents errors and ensures the best possible outcomes for patients. 15. How would you handle receiving constructive feedback? I handle constructive feedback positively by listening carefully, reflecting on the advice, and making improvements. I see feedback as an opportunity for growth and professional development. I don't take it personally, but focus on learning from it. If I need clarification, I ask questions respectfully. By applying the feedback to my work, I strengthen my skills and contribute more effectively to the team and patients I support in healthcare. 16. How do you build rapport with patients? I build rapport by greeting patients warmly, introducing myself clearly, and taking time to listen to their concerns. I adapt my communication style to meet their needs, whether they require reassurance, clear explanations, or just empathy. Consistency, respect, and patience help develop trust. I also remember small details that matter to them, showing genuine care. This personal connection helps patients feel more comfortable and supported during their healthcare journey. 17. How do you stay organized during your shift? I stay organized by using task lists, setting priorities, and updating them as situations change. I maintain a structured approach to ensure all tasks are completed on time. Effective communication with colleagues helps avoid duplication and ensures smooth workflow. I also build in flexibility for unexpected events. Staying focused, using time wisely, and documenting tasks properly keep me on track. This ensures that patient care is delivered consistently and effectively. 18. How would you handle conflict with a colleague? If I had conflict with a colleague, I would remain professional and approach them calmly to discuss the issue privately. I would listen to their perspective and express my own respectfully. The goal would be to find common ground and resolve the matter constructively. If the issue could not be resolved, I would follow the proper escalation process. Maintaining professionalism and teamwork is vital, as conflict must not affect patient care. 19. What are your strengths? My strengths include excellent communication skills, strong organization, and the ability to stay calm under pressure. I am compassionate, patient-focused, and dedicated to teamwork. I adapt well to changing environments and remain flexible in handling unexpected challenges. I also have attention to detail, which helps me ensure accuracy in tasks. These qualities allow me to contribute positively to healthcare teams and ensure high standards of patient care in the NHS. 20. What is your greatest weakness? My greatest weakness is sometimes taking on too much responsibility, as I want to support my colleagues and patients fully. However, I've been working on improving this by setting realistic limits and asking for help when necessary. I now focus on prioritizing tasks and delegating appropriately, ensuring I remain effective without becoming overwhelmed. Turning this into a learning experience has helped me develop balance while maintaining patient safety and quality care. 21. How do you ensure patient safety? I ensure patient safety by following protocols, paying attention to detail, and maintaining accurate records. I check equipment and environments for hazards, reporting concerns promptly. Communication with colleagues is key to avoiding errors. I also engage patients by explaining procedures clearly and listening to their concerns. Staying alert, adhering to infection control practices, and remaining vigilant ensure risks are minimized. Patient safety is always my top priority in every healthcare situation. 22. How do you handle working under pressure? I handle working under pressure by staying calm, organized, and focused on priorities. I use checklists and communication with the team to manage tasks efficiently. I remain adaptable when unexpected challenges arise, adjusting my approach while maintaining accuracy. I also remind myself to breathe and keep patient safety at the center. By staying positive and resilient, I can continue delivering high-quality care even in demanding and fast-paced healthcare environments. 23. How would you support a patient with special needs? I would support a patient with special needs by treating them with dignity, patience, and respect. I would adapt my communication style, ensuring clarity and understanding. I provide extra reassurance, explaining procedures carefully. Collaboration with colleagues and following care plans would help meet their specific needs. I'd also listen to feedback from the patient and their family to improve care. Compassion, flexibility, and attentiveness are essential to supporting vulnerable patients effectively. 24. Why should we hire you for this role? You should hire me because I have the skills, compassion, and dedication to excel in this role. I am organized, dependable, and committed to delivering patient-centered care. My strong teamwork, problem-solving, and communication abilities ensure I work effectively within the NHS. I also have a genuine passion for helping people, combined with resilience in challenging situations. I am confident I can contribute positively to your team and uphold NHS values. 25. Where do you see yourself in 5 years? In 5 years, I see myself continuing to grow within the NHS, gaining further experience and possibly progressing to a higher band role. I aim to develop my skills through training and hands-on experience while continuing to provide excellent patient care. I would like to take on more responsibilities, supporting both patients and colleagues. My long-term goal is to contribute meaningfully to the NHS while building a fulfilling career. In conclusion, preparing for an NHS Band 3 interview means demonstrating compassion, resilience, and professionalism while aligning with NHS values. By practicing these questions and answers, candidates can show their readiness to handle responsibilities, support patients, and work effectively within healthcare teams, increasing their chances of success.